giáo sư Alan Way về các cái kiểu luồng thông của cái động tĩnh mạch màng cứng vùng tủy sống. Xin trân trọng kính mời trình cái bài trình bày đã được ghi lại.
Hi everybody, I'm so happy to be back in Vietnam, or actually I wish I would be there with you. So our first presentation, I will speak about spinal vascular malformation, and obviously in 20 minutes it's very difficult to have a complete understanding of the topic, but I'll try to focus on what is important, at least for me, and also focus on the difference between dural and epidural. So further conflict of interest, I have no conflict of interest related to this presentation. However, our department receive educational and research funds from different companies. So it could be very, very intimidating. The classification of vascular malformation could be difficult and intimidating. And actually there is a lot of paper when you look in 2002, this one obviously from Pierre Lajeunesse tried to classify them. Then you can find some other paper a little bit later, and it's interestingly enough from Ukraine here in 2006, and here in 2010 from Timo Krings, so my colleague from Toronto, and from Japan, and also from here I think it's United States. But anyway, those are quite complex and intimidating, and eventually are useful, but I think we have to simplify all this. So interestingly enough, it's a topic where I was fascinated since the beginning of my career. Here you have a case report actually where we had, it was a paraspinal vascular malformation with huge, as you can see, vascular pouch, creating some mass effect on the spinal cord and on the spinal vertebra, which we were able to treat quite successfully with complete cure, as you can see, but actually quite in a simple way. And I was fascinated by that, and then I developed a specific interest in that. And after this case report, or after looking at this case, I realized that there is two questions you need to ask yourself. I will try to move this because it's difficult. Okay, so the two questions you need to ask yourself is the first one, where is the chance? And the second, why knowledge of this vascular malformation is relevant. Okay, so I'm again in trouble. Okay, I'm again in trouble. Okay, sorry about that. So I go back where I realized there are two questions you need to ask. We were on this. So the first one is, where is the shunt? And so here the bar is really annoying. Okay, so the shunt could be, you know, actually outside the spine, or some call it paraspinal, at the level of the spine, where it could be outside the canal, basically at the level of the vertebra, or inside the canal, which could be actually epidural, dural, or intradural. And me personally, I have the tendency to distinguish between extramedullary and intramedullary. After that could be even more complex and could have a mix of the above. Here are some slides where it's obviously a spinal AVM, but which is inside the cord, the spinal cord. So, preparing this topic, I found this article, which I did not know, from my colleague from Toronto, which actually drew some very, very nice picture, and you can easily refer to it because it's, I think, a very good paper, which again, very nice drawings, which allow you to understand. So the second question is, why knowledge of this vascular malformation is relevant. So it is relevant because it creates symptoms, which is pretty obvious, and also eventually if there is no symptom, because it could be dangerous, being symptomatic with irreversible damage. So, and actually why such an AVM creates symptoms and it's the same as in the brain, could be by mass effect, which is mainly when there is a venous pouch, by venous congestion, and that's probably the most frequent way those fistulas or AVM or vascular malformation of the spine create problem, could eventually rupture or thrombose, which is actually fairly rare, at least for the paraspinal and the dural fistula, and obviously more frequent for the intradural. And we can eventually discuss Stilling effect, although I've never seen that. So obviously, when you are speaking about spinal vascular malformation, MRI and symptom, but mainly MRI is key. But as we will see, is not specific. Here, for instance, we have an MRI of the spinal cord with, you see the conus here, which we would say is a typical aspect of a dural fistula. You know, you see here the edema of the lower dorsal cord and of the cone. And when you look at the contrast, the T1 post-gadolinium, you see that there is some contrast with some vessel enhancing along the cord. So that was a typical, again, the typical aspect on MRI about what we generally see. When we see that, we think dural fistula. And here is the case of this lady who was 69 years old with progressive paraparesis. It's look like there is also some vessel, intradural vessel with edema on the conus, so we would think this is a dural fistula. However, we did a complete spinal angiogram and we didn't find anything. But when we were injecting both iliac arteries, we realized that there was a vascular malformation of the pelvis. And actually, when you look closely, this vascular malformation of the pelvis was draining through a big vein here up, and from this vein, there was some reflux into a paraspinal vein entering the sacrum and giving, as you can see with the narrow here, some reflux into intradural vein and creating the congestion and actually creating the exactly same condition of the dural fistula. So as you can see here, a paraspinal or fistula, which has nothing to do actually with the spine, could create some symptoms and some MRI picture exactly the same as the dural fistula. And here is a CT scan of this lesion where you can see the big vein here, and with the blue arrow here, you see that it's the vein which is, I think the vein, the blue arrow here is displaced. But anyway, you see that the vein is entering through a sacral foramen and is entering intradurally and can create then symptoms similarly to dural fistula. So here is another case where we can see again this, let's say, typical aspect of dural fistula, where you see again the edema of the chord and of the conus with large vessel, and also those patchy gadolinium enhancement of the chord. And here it is a dural fistula, no doubt, but it's at the sacral level, could be at the sacral level. What is interesting here, notice the small feeders which are alongside of the dura mater, and after that converge to create this reflux into this intradural vein. And here is the typical aspect then of a dural fistula. And you can see here post-embolization on the CT scan that we have filled those very teeny vessel along the dura, and finally the intradural veins with glue here in this case. I think it's glue, but I'm not sure. It could be onyx. So here exactly the same case with edema of the lower chord, and also here some contrast uptake. But you can see something which is slightly different here. You can see that there is a little mass effect here coming from the epidural space, you know, and here you have it with the arrow. But to be honest with you, at the beginning we didn't see that. It's only after the angiogram that we went back on the MRI and we saw this. And here is the angiogram, and the angiogram is very interesting because it feels, you can see this is an intercostal artery, I think, I don't remember, but it's probably L2. And we feel here a kind of pouch, you know, and this pouch just drain into a dural vein, as you can see here. And you can see that the aspect, if I go back to the dural fistula, you know, here is radically different, because here in this dural fistula there is not any pouch like we have seen, like we see it here. And here we have done an embolization. Here we do a super selective catheterization through a small branch going into this pouch, which is actually here, which is into the epidural space, which drain to a dural vein. So actually, as you can see, it's different from the dural fistula, where it's at the level of the dura mater. Here, it's really epidural, and the draining vein, you know, cross the dura mater and join and create the same symptom in the same picture on MRI. And here we were able to feel completely the pouch and have some additional glue into the draining vein, into the dura. Here, the same, as you can see here on the CT scan, that the epidural pouch was filled, and you can see here clearly that it's epidural. Because and this is a control 3 months later, and we can see that the edema has disappeared, likewise the big vessel. So here, another case where you would say probably a dural fistula, you know, the edema of the cone and some patchy contrast uptake of the cord, and probably some little vessel. But actually, as I showed you a dural fistula at the sacral level, here there is an epidural fistula at the sacral level, and it's exactly the same. You can see that when you inject, you know, selectively, you know, here the sacral branch, you have a pouch which is filling and draining into a dural vein and creating the same symptoms as the dural fistula. And here it was again after embolization, and you can see here clearly also that the material is epidural, you know, the embolization material is epidural, and you can see on this sagittal cut and also on the plain films that the glue or the onyx here, I think it was onyx here, just filled the dural vein, and you can be sure or almost sure that the patient is cured. And you can see nicely the epidural pouch and here the dural vein. So finally, because I was speaking about classification of spinal vascular malformation, here another case where I can show you that the picture, at least on the MRI, is really not specific about the location of the spinal malformation. Sometimes it could be misleading. This is a 12-year-old boy who had a sudden headache and mainly lower back pain, had negative head CT. We did a lumbar tap, and the lumbar tap, we had a lot of blood. And here again, you can see that there is a lot of vessel around the conus. You know, we don't see clearly an AVM or whatever, you know, there might be a little bit of edema in the conus, but actually here you recognize that it's an anterior spinal artery, which is filling vascular malformation. Necessarily it's intradural because it's supplied by an anterior spinal artery, actually two. There is one coming from lower down, and this one is coming from up, which fills this vascular malformation. And you can see, interestingly enough, that there is an aneurysm here, you know, on the anterior spinal artery before it reaches the arteriovenous malformation of the cord here, or of the conus. And this aneurysm, we were able actually to navigate through the anterior spinal artery and coiled it, you know, to prevent any rebleeding, because we really thought that was the source of the bleeding of this kid. So at 3 months, the aneurysm remained closed. However, we can see that we didn't touch the vascular malformation of the conus here. So what I wanted to say, and in 20 minutes it's very difficult to summarize such a long topic, but basically, or again, preparing this presentation, I found this article, which I did not know also, even though it's from friend, mainly Georges Rodèche. And so it's a good article in Revue Neurologique also. And he highlights, and I completely agree, and it was almost a conclusion I wanted to say. He said there are 4 types of spinal cord arteriovenous malformation: paraspinal, epidural, dural, and intradural. Yeah, you can classify like that. I generally do paraspinal, spinal, extracanalar, intracanalar, which could be epidural, dural, or intradural, and I distinguish personally extramedullary and intramedullary. For instance, you know, a vascular malformation of the filum is an extramedullary, and the one I show you at the cervical level was obviously an intramedullary lesion. But anyway, that's not so important. What is important here, it's true that it's a vein which represents the key factors responsible for the neurological symptoms, generally most likely through progressive by congestion. Compression is pretty rare, but we have seen, you know, some case with big pouch, venous pouch, which can create some cord compression, can also rupture or thrombose. Mainly, we will see that in intradural vascular malformation. MRI and MRI at the first choice examination, obviously, you know, it's the best examination for those, but digital subtraction is mandatory to understand clearly the angio-architecture and also the location. What I would add to this conclusion, and that was a little bit more specific to this topic, that dural and epidural are often confused. I hope now, since I show you this intermediate pouch, you know, which really makes the difference, and you have this pouch with draining vein instead of having those network of small vessel irrigating the dura. So I hope you will understand. Thank you very much.